So we have seen the management, that is supportive therapy, in the previous slides. Now the respiratory therapy. In respiratory therapy, administer oxygen through mask with the high flow system. The continuous monitoring of the SpO2 should be done, and also ABG analysis also should be done daily. That is to find the oxygen saturation in the blood. Also, whether if the patient develops metabolic or acidosis or alkalosis, that also can be assessed using this ABG, arterial blood gas analysis. Then mechanical ventilation for ARDS patients. Patients will need, definitely these patients will need mechanical ventilation. In mechanical ventilation, PEEP, that is positive and expiratory pressure, should be kept at 10 to 20 centimeter of water. It helps to open up the collapsed alveoli and increases FRC. Okay, then ECMO and CO2R also can be used. This picture you can see here how PEEP helps in expansion. See here, this is a normal, if we consider it as a normal alveoli, what happens in normal respiration is during inspiration the alveoli will be inflated like this, and during expiration that will be the whole air in the alveoli will be removed. And if we are keeping the PEEP, that is at the end of the expiration a positive pressure will be kept. In such condition the alveoli will not collapse like this. Okay, a small amount of air will be present in the alveoli. Then what is ECMO? That is extracorporeal membrane oxygenation. Pass venous blood across a gas exchanging device, that is oxygenator, outside the body, and then return oxygenated blood back to the body via central vein or artery. Lungs are kept at rest for healing. Then this one, extracorporeal carbon dioxide removal. Extracorporeal carbon dioxide removal uses an extracorporeal circuit outside the body to directly remove carbon dioxide from the blood. This is much more effective when compared to ECMO. Then respiratory therapy. In respiratory therapy, other things are positioning strategies. Positioning strategies means patient should be provided with the prone position and also lateral rotation. In prone position is given to the patient because it reduces pressure on the lungs. See here, patient is turned into the prone position. From supine position, the patient should be completely turned to the prone position. Okay, it reduces pressure on the lungs. And why lateral rotation? Lateral rotation means continuous lateral rotation therapy and kinetic therapy can be given because in the alveoli the fluid will be collected. To slow and side to side turning by rotating the bed frame, it helps to move the collected fluid out of the alveoli and helps in the inflation of the alveoli, and this air rushes into the alveoli. And vibrator pack also can be attached here because that aids in removal of the or movement of this fluid from the alveoli. Then mobilization of secretion. Other than this, for mobilization of secretion, we can definitely use postural drainage. If lateral rotation is not possible with on the bed itself, then postural drainage can be used, and along with that effective cuffing should be used, and also incentive spirometry. Proper hydration and humidification is needed to remove the or mobilize the secretions. Then chest physiotherapy and airway suctioning. These are also needed. That is mobilization of secretion. Okay. Now drugs used for ARDS. According to the course, it is antibiotics. If in case of bacterial infection, antibiotics should be used, and anti-inflammatory drugs like corticosteroids are used because we have seen this ARDS is resulting from inflammatory mediators in times. So corticosteroids can be administered. Then diuretics diuretics to remove the fluid. Okay, then drugs to raise blood pressure like dopamine and dovitamin. Then anti-anxiety drugs can be administered. Muscle relaxants should be administered because the patient is on ventilator. When a patient is put on ventilator, there will be ventilator patient struggle will be present, so muscle relaxants should be given. Then inhaled drugs like bronchodilators can be administered because these inflammatory mediators can cause bronchoconstriction, so inhaled drugs also can be given. The nursing management, nursing diagnosis are ineffective breathing pattern related to decreased lung compliance, decreased energy as characterized by dyspnea, abnormal ABGs, cyanosis and use of accessory muscles. Second one is impaired gas exchange related to diffusion defect as characterized by hypoxia, hypercapnia, tachycardia and cyanosis. Risk for decreased cardiac output. Then fourth one, ineffective protection related to positive pressure ventilation, decreased pulmonary compliance and increased secretions as characterized by or as evidenced by crepitus, altered chest excursion, abnormal ABGs and restless. Then impaired physical mobility. Sixth one is risk for impaired skin integrity. The knowledge deficit related to health condition, new equipment and hospitalization as evidenced by increased frequency of questions posed by the patient and significant others.